Hello, I'm Congressman Mike Honda. Take a moment to watch these videos to hear firsthand how people in our community are being affected by the lack of healthcare reform and why we need healthcare reform now. What we're doing is we're asking folks to share from their point of view and from their life and their work and their families what and how the administration's health insurance, health package, health initiative would affect them, and thereby, we can sort of reach out and teach folks what the pieces are that would be of importance for this country. So, welcome and thank you very much for being here.
I appreciate being asked to give some input. We're a retail furniture business. We've been in business for 31 years, and we currently employ 36 employees.
Yeah.
And of which of our 36 employees, we have about 25%, 10 of them that are not able to even participate even 50% of the premium. We pay 50% of the premium. We're Kaiser.
Yeah.
And we have 15 of our staff are Kaiser employees. They pay half, we pay half. And then another 6 that are picked up either through Medi-Cal or through their spouses. And then we have the rest are just simply have no insurance.
Yeah.
And usually they're the employees that are in the $10, $12, $13 an hour positions. That's who we're talking about.
Yeah. It's pretty unusual for a business your size to provide insurance at the 50% level, and yet, in spite of that, there will be some folks that are not covered, and it's sort of kind of like a reflection of this country where there's about 47 million folks who are not covered, and they should be. Maybe you could tell us what your value system is that you operate from that really drives you forward, and maybe your assessment of what this bill can do.
Making sure that all employees of our staff, and I think it's very important to cover the health care needs. We got to come up with a solution. We got to find an equitable way to make it work that doesn't become too much of a burden on anyone. I think that everybody, I think you said it earlier, is that the idea is we all need to have a little skin in the game on this, and we all need to be willing to play our part to make sure that the coverage is provided, and we can hold down the cost and have something that competitive that that keeps healthy workers and make sure that it's equitable to all the employees. I think that's very important, and I'm willing to do my part as a business to help that come about. I support what I think that we do need the reforms. Every year, a typical 15% or better increase in insurance. The premiums, and so I think that we need to do something that is will incorporate the needs of all the employees.
The last thing I want is to be cast alone on the street, sick, trying to find a doctor that will take my case and give me the treatment I need. You have to be a rocket scientist to be able to address the complexity of medical and insurance issues now. A sick person isn't prepared to do that.
And your kind of a situation is kind of a situation that's fading away because your health insurance is connected to your pension. And
exactly.
It's a lifetime thing.
Yeah, and that's the thing that makes me so concerned about the reform program, because I have been terribly fortunate to have a good employer, to have access to a good health plan, and to have my employer, as part of my pension, carry that through into my golden years.
Sure.
But now, the way the economy is going, the way the country is going, no worker is guaranteed that now. That's the concern to my children. No worker now is guaranteed a pension. No worker now is guaranteed health coverage. You change your job, you're out on the street once again trying to get health coverage.
I have a 32-year-old son that was born, well actually he developed juvenile diabetes at 3.5 years old. And we've had problems all along. It wasn't until he got into his 20s that he started having more problems. And he was working, doing as good as he can. He got laid off from his job, I guess right after 9/11. Business started slowing down, so he lost his job, was laid off, and he was given an option to go onto COBRA, which was very, very expensive, and he didn't have the money at the time, and we didn't have it at the time. So we decided, well, that's okay, we'll look around for some insurance and get you on. And everywhere we called, he was on Kaiser. Kaiser wouldn't take him on outside of the COBRA because he had pre-existing conditions and they just wouldn't touch him, although that was his insurance. So we called around to different insurance companies. Everybody was really nice, you know, oh yes, we can get him on, and they laid out, you know, how much it would be for his age, and it was really inexpensive. But once they found out that he had all these pre-existing conditions, they said they couldn't cover him. It was just not in our interest to insure him with that company, those companies, because it was just really expensive and they didn't have anything to offer.